Good day, everyone. Thank you for joining today's mental health training on February 11, 2025. I am pleased to present our research on the comparative study of policy and curriculum related to school-based mental health literacy in Indonesia, the Philippines, and Japan. This study aims to examine the differences, challenges, and best practices in mental health education across these three countries. Through this analysis, we seek to identify effective strategies and policy recommendations that can enhance mental health literacy in schools, ensuring that students receive the support they need. Let us begin by exploring the current state of mental health policies and curricula in these regions. In this presentation, I will first define mental health literacy, explaining its significance in education. Then, I will introduce the three target countries in our study: Indonesia, the Philippines, and Japan. Next, I will discuss the progress of data collection and analysis, followed by an in-depth look at mental health literacy policies in the Philippines. I will then explore how mental health literacy curricula are structured in schools across the three countries. After that, I will highlight the progress and challenges each country faces in implementing mental health education. Finally, I will conclude by summarizing key findings and discussing potential improvements for future policy and curriculum development. Mental health literacy, as defined by Jorm et al. 1997, refers to the knowledge and beliefs about mental disorders that help in their identification, management, and prevention. In the context of school-based mental health education, the primary goal is to enhance students' understanding of mental disorders through curricular interventions. By improving knowledge and awareness, schools can play a crucial role in reducing stigma, promoting early detection, and supporting mental well-being among students. According to Jorm 2012, mental health literacy consists of several key components that enable individuals to better understand and manage mental health issues. First, it includes knowledge of how to prevent mental disorders, helping individuals adopt proactive strategies for mental well-being. Recognizing when a disorder is developing is another crucial aspect, allowing for early intervention. Additionally, understanding help-seeking options and available treatments ensures that individuals can access appropriate support when needed. Effective self-help strategies for managing mild mental health issues are also essential for fostering resilience. Finally, having first aid skills enables individuals to provide immediate support to those in crisis, ensuring timely assistance for those struggling with mental health challenges. These components collectively empower individuals to take an active role in promoting mental well-being. This study compares the policies and curricula related to school-based mental health literacy in the Philippines, Indonesia, and Japan. These three countries have successfully developed mental health laws and policies that address the needs of both adults and school-aged children. Each country has unique government structures and approaches to mental health education. The Philippines and Japan have centralized education systems, while Indonesia follows a decentralized approach. In terms of responsibility for mental health programs, the Philippines relies on the Department of Education, Department of Health, and local government units. Indonesia's system involves the Ministry of Health, the Ministry of Education and Culture, and the Ministry of Social and Welfare. In Japan, mental health services are coordinated by the Ministry of Health, Labor and Welfare alongside the Ministry of Education, Culture, Sports, Science, and Technology (MHL). Multi-sector involvement also varies. The Philippines includes NGOs and the Philippine Council for Mental Health, while Indonesia integrates educational and religious sectors. Japan incorporates MHL and various governmental institutions to ensure comprehensive mental health policies in schools. This comparison provides insights into different approaches and best practices, helping to identify effective strategies for improving mental health literacy in schools across Asia. To understand the state of school-based mental health literacy, this study conducted data collection and data analysis through two key approaches: policy document reviews and curriculum reviews. For the policy document reviews, policies formulated between 2000 and 2023 were collected, translated, and screened. These documents were then analyzed through policy content analysis, focusing on key elements, actors, and content. Additionally, a policy mapping analysis was conducted to summarize global mental health guidelines and UN agency manuals. The curriculum reviews covered school curricula from grade 1 to grade 12. The analysis followed a deductive approach based on previous research, particularly Jorm's 2012 framework on mental health literacy. This structured approach ensures a comprehensive examination of how policies and curricula shape mental health literacy in schools across different countries. This slide presents key national policies in the Philippines that support school-based mental health literacy. The policies come from both the Philippine national government and the Department of Education DepEd and include Republic Acts, department orders, and memorandums. Notable policies include the Enhanced Basic Education Act RA 10533, which established the K-12 curriculum, integrating values education into the school system. Another key policy is the DepEd Child Protection Policy DO No. 20S.2012, which focuses on preventing abuse, exploitation, and discrimination among students. Additionally, the DepEd Task Force COVID-19 Memorandum No. 82/2020 was issued to strengthen psychosocial support services for students, parents, and teachers, particularly in response to pandemic-related mental health challenges. These policies highlight the Philippines' commitment to mental health literacy, ensuring that students receive adequate education, protection, and support services in schools. This slide provides an overview of the key stakeholders involved in school-based mental health literacy policies in the Philippines. The Department of Health DOH plays a crucial role by implementing a community and recovery-based approach to mental health care, supporting integration between schools, workplaces, and healthcare facilities. It also focuses on research and policy development to improve mental health services. The Department of Social Welfare and Development DSWD, in coordination with local government units LGUs and the DOH, is responsible for mental health resilience programs, particularly for students affected by natural disasters and crises. At the school level, teachers provide counseling and referral services to students in need. If necessary, students are referred to guidance counselors, who assess their situation and arrange further support services. These policies emphasize a multi-sectoral approach, ensuring that schools, government agencies, and health institutions work together to provide comprehensive mental health support for students. Mental health facilities, academic institutions, and professionals collaborate to build capacity and provide evidence-based, culturally sensitive mental health services. The Department of Education DepEd plays a significant role in promoting mental health awareness, including the dissemination of helplines and resources for students and educators facing psychological distress. At the higher education level, the Commission on Higher Education CHED and the Technical Education Skills Development Authority TESTA ensure that mental health programs are integrated into public and private institutions, following age-appropriate and evidence-based standards. Additionally, educational institutions are required to develop policies and programs that raise awareness, provide support services, and establish referral systems for students and staff in need of mental health assistance. This multi-level approach ensures that mental health literacy is embedded across all educational levels, fostering a comprehensive and supportive system for students, educators, and school staff. Now, let's evaluate the extracted policies on school-based mental health literacy by examining their commonalities and differences across the three countries. Commonalities. Each country has developed school mental health policies that address the challenges of mental illness and health issues among children and adolescents. The Philippines, Indonesia, and Japan have established guidelines or a course of study for K-12 curricula, ensuring that mental health literacy education is incorporated at each level, primary, middle, and secondary school. Differences. The role of schools in mental health literacy education varies across the countries. In Japan, multiple stakeholders, school nurses, medical institutions, and national/local governments, are actively involved in providing mental health education to students. In the Philippines, school-based mental health literacy education is only partially implemented, indicating a need for further integration and expansion. In Indonesia, however, schools and educational institutions are barely involved, highlighting a significant gap in implementation. This comparison reveals that while all three countries recognize the importance of mental health literacy in schools, the extent of integration and execution differs, with Japan leading in implementation, followed by the Philippines, and Indonesia still in the early stages. The policy content analysis identified the key actors responsible for implementing school-based mental health literacy policies in the Philippines, Indonesia, and Japan. These actors play a crucial role in shaping and delivering mental health services within the education system. In the Philippines, multiple institutions contribute, including the Department of Health DOH, Department of Social Welfare and Development DSWD, local government units, teachers, and guidance counselors. Additionally, higher education institutions and technical education authorities ensure mental health awareness is integrated at all levels. In Indonesia, educational institutions, the Ministry of Health, religious organizations, and community leaders play a significant role. Their approach incorporates primary healthcare centers and religious figures in providing mental health support. In Japan, the Yogo teacher, school nurse, local medical institutions, school counselors, and social workers are central to mental health services. The national and local governments and the Children and Family Agency also oversee policy implementation. These varied approaches reflect differences in governance, cultural influences, and education systems across the three countries. This comparative analysis helps identify best practices and areas for improvement in school-based mental health literacy. This slide presents a comparative analysis of mental health literacy MHL curricula in elementary schools grades 1 to 6 across the Philippines, Indonesia, and Japan, based on JORM's framework. In the Philippines, mental health topics are integrated into health education and values education. Topics include emotional expression, mental and social health, substance abuse prevention, and emotional resilience. Self-help strategies such as confidence, empathy, and perseverance are emphasized, along with community support systems for seeking help. In Indonesia, mental health literacy is embedded in religious education. Students learn how religious beliefs contribute to emotional regulation, conflict resolution, and moral development. There is a strong focus on self-awareness, self-uniqueness, and ethical behavior as preventive measures. In Japan, MHL is covered in health and physical education, with a focus on disease prevention, substance abuse, and mental well-being. Students learn about the connection between mind and body, anxiety management, and healthy coping strategies. This comparison highlights different cultural and educational approaches to mental health literacy. While the Philippines and Japan emphasize health education and emotional development, Indonesia integrates MHL through religious and moral education. These insights provide valuable perspectives for strengthening mental health education in schools. In health education, students are introduced to mental health concepts, including holistic health, adolescent nutrition, and eating disorders. They also learn about common mental disorders, their triggers, and prevention strategies. Substance abuse prevention, focusing on gateway drugs, alcohol, and tobacco, is also emphasized. To help students recognize early signs of mental health issues, the curriculum covers stress management, coping mechanisms, and the impact of peer and school-related stressors. Violence in schools and its psychological effects are also addressed. Students are taught help-seeking strategies, including how to identify reliable support systems and professional mental health services. The curriculum also fosters self-awareness and coping skills, helping students navigate challenges like bullying, self-harm, domestic violence, and sexual abuse. Additionally, first aid skills for mental health crises are included, ensuring that students can support peers experiencing distress or a mental health emergency. By embedding these topics in education, the Philippines curriculum aims to equip students with essential mental health knowledge and skills, fostering resilience and emotional well-being during adolescence. Students are also taught effective coping strategies, particularly in dealing with stress and personal relationships during middle and late adolescence. However, there is no dedicated curriculum on first aid skills for mental health crises, highlighting a potential gap in mental health education. By integrating these topics, the high school curriculum aims to equip students with essential skills for mental well-being, self-awareness, and resilience, preparing them for the challenges of adulthood. This slide compares how mental health literacy MHL is integrated into school curricula in the Philippines, Indonesia, and Japan. Both the Philippines and Japan incorporate stress management and the prevention of smoking, drinking, and drug abuse as core topics in their MHL curriculum. In contrast, Indonesia embeds mental health education within religious education, emphasizing self-awareness, self-observation, and self-uniqueness from an early age. Each country takes a different approach to mental health education. The Philippines includes health education, values education, and personal development as key subjects, promoting a holistic view of mental and physical well-being. Indonesia integrates MHL into religious education and social studies, linking mental health to moral and ethical development. Japan primarily addresses MHL through physical education, highlighting the connection between physical activity and mental well-being. Despite these differences, all three countries recognize the importance of both physical and mental health education, adapting their approaches to fit their cultural and educational contexts. This slide highlights the distinct approaches to school-based mental health literacy MHL curriculum construction in the Philippines, Indonesia, and Japan. The Philippines adopts a multifaceted approach, combining policy development, curriculum integration, and comprehensive support services. This dynamic and inclusive strategy ensures that mental health is embedded at multiple levels of education and school systems. Indonesia emphasizes the importance of a healthy school environment by focusing on emotional and social skill development. This preventive and proactive strategy aims to build resilience in students from an early stage. In contrast, Japan follows a structured and comprehensive approach that integrates prevention, recovery, and coping strategies within the curriculum. With the allocation of specialized personnel, Japan demonstrates a strong commitment to providing expert care and support for students' mental well-being. Each country's strategy reflects unique cultural and educational priorities, yet all share the goal of promoting mental health awareness and resilience among students. Now, let's discuss the progress and challenges in the implementation of mental health literacy MHL programs in the Philippines, Indonesia, and Japan. In the Philippines, the community-centered and multidisciplinary approach stands out, ensuring that various stakeholders, including health and education sectors, collaborate effectively. However, a key challenge is the need for continuous support from national policies to integrate mental health strategies into broader health and educational frameworks. In Indonesia, a major strength is the collaboration among professionals from diverse disciplines, ensuring a more holistic approach to student mental health. The challenge, however, lies in the integration of mental health education within religious education, particularly in primary and secondary schools, which requires further development. Japan excels in its utilization of specialized personnel, such as school nurses, yoga teachers, and psychologists, emphasizing a structured system for expert mental health care. The challenge here is the lack of a dedicated national policy for mental health literacy education, which should be addressed to establish a structured and comprehensive framework for supporting students' mental health needs. Each country has made notable progress in different ways, yet challenges remain in ensuring sustainable, inclusive, and well-integrated mental health education policies. To conclude, our analysis highlights the differences in curriculum approaches to mental health literacy MHL across the Philippines, Indonesia, and Japan. The Philippines provides a comprehensive MHL curriculum spanning kindergarten to grade 12, ensuring a structured and continuous approach. In contrast, Japan incorporates MHL within health education between grades 5 to 10, while Indonesia integrates mental health concepts into religious education across grades 1 to 12. Despite these efforts, Japan lacks a dedicated national policy for mental health literacy, unlike the Philippines and Indonesia. One of the key challenges identified is the absence of formal, first aid skills training for supporting students experiencing mental health crises. This underscores the need for trained personnel, such as teachers and counselors, who can effectively intervene and provide immediate support when necessary. Going forward, addressing this gap by incorporating structured first aid mental health training into school curricula could enhance the effectiveness of MHL programs and better equip educators to support students in distress.